Hi, my name is Laura Andrews, and this is my Appendicular Skeleton Lab for Biology 235 Anatomy at Azusa Pacific University. Starting out, we will talk about the clavicle, or the collarbone. Here, it runs with a link here, and here we have the sternal end, and laterally, we have the acromial end. Now, focusing on the posterior of the spine, of the thoracic cage, we have the shoulder blade, or the scapula. This bony protrusion here is called the coracoid process. This fossa up here is the supraspinous fossa, and inferior to that we have the infraspinous fossa. On the anterior part, you can't see it here, but we have the subscapular fossa. Going back posterior, we have the glenoid cavity right here. This bony area is the spine of scapula. And then this area right in there is the acromion. And this joint is called the acromioclavicular joint, and it is our shoulder joint. And here we have the sternoclavicular joint, where the sternum joins with the clavicle. Now moving on to the arm, or the brachial. The brachial consists of the single bone called the humerus. Up here we have the head of the humerus, where it articulates with the glenoid cavity of the scapula. Laterally, we have the greater tubercle, and medially, we have the lesser tubercle. Halfway down the shaft of the humerus, we have the deltoid tuberosity. And at the distal end of the humerus, we have the medial epicondyle and the lateral epicondyle. Now, in between these two, we have the coronoid fossa, which is where the coronoid process of the ulna articulates. We have the capitulum here, which articulates with the radius. Doesn't quite show in this particular area. And then on the posterior side of the humerus, we have the trochlea, which articulates with the ulna, and we have the olecranon fossa, which articulates with the olecranon of the ulna and enables the hinge joint of the elbow to function. Now discussing the antebrachial, or the forearm. The forearm consists of two bones, the ulna, which is larger, and the radius, which is smaller. The ulna, when in the prone position, lies medially, and the radius lies laterally. So with the ulna, at the head of it, we have the olecranon process, which articulates, as I mentioned, with the olecranon fossa. We have the coronoid process anteriorly, which articulates with the coronoid fossa. I have the styloid process at the distal end. And then on the radius, I have the head of the radius, the radial tuberosity here, and the styloid process at the distal end where it articulates with the metacarpals. Now we move on to the carpus. Excuse me. The proximal row from lateral to medial, remember the hand lies like this, so from lateral to medial, we have the scaphoid, the lunate, the triquetral, and the pisiform. On the distal row, we have the trapezium, trapezoid, capitate, and the hamate. All 8 of these bones articulate with the ulna to form the wrist. The joints that form the pollex are the trapezium, the scaphoid, metatarsal 1, and the proximal and distal phalanges. These bones here are the metacarpals, and these here are the proximal and distal phalanges. Now moving on to the pelvic girdle. The pelvic girdle is composed of 3 bones fused together. We have the ilium, the ischium, and the pubic bone, which is fused together and has the pubic symphysis connecting the left and the right pubic bone. And this is a small piece of cartilage that allows for the slightest of movement. Now, in addition to these, we have the acetabulum, which is where the head of the femur articulates. We have the orbiter foramen. We have the iliac crest. We have the anterior superior iliac spine. And this here is the depression called the iliac fossa. Now, posteriorly, we have the greater sciatic notch, which allows the sciatic nerve to run and innervate the lower body. We have the ischial spine, and we have the ischial tuberosity, or our sitting bone. Now we'll move on to the leg. First, we will start with the femur, and the femur is the largest, sturdiest bone in the human body. So first, we have the head of the femur, which articulates with the acetabulum, as I mentioned previously. We have the greater trochanter, which is this bony protrusion here, as well as the lesser trochanter, which is the medial trochanter. On the distal end, we have the adductor tubercle. We have a medial epicondyle here and a lateral epicondyle here. Posteriorly, we have the medial condyle and the lateral condyle. And then on the anterior side one more time, we have the patella, or the kneecap. Now focusing on the lower leg. The lower leg is composed of two bones, just like the antebrachial is composed of two bones. And first we have the tibia, which is the larger of the two, and the fibula, which lies lateral. So on the tibia, we have the medial epicondyle, the medial condyle and the lateral condyle. We have the tibial tuberosity here. We have the proximal and the distal tibiofibular joints, where the tibula articulates with the fibula. On the fibula, we have the head of the fibula, as well as the lateral malleus, which is the bony protrusion on your ankle that you can feel. This is your ankle bone. And finally, we will end with the tarsus, or the foot. So the talus articulates with the tibia, fibula superiorly, and the calcaneus and the navicular inferiorly. And we have the calcaneus here, or your heel. We have the trochlea of the talus. We have the talus here. We have the cuboid medially. We have the lateral cuneiform, the intermediate cuneiform, and then the medial cuneiform. And just below this, we have the navicular. So I have the cuboid here, lateral cuneiform, intermediate cuneiform, medial cuneiform, navicular here, talus, calcaneus, the metatarsals, the phalanges, and the hallux, or the big toe. And there you have it, the appendicular skeleton. Thank you so much.